So thank you very much. So yes, Sean is my name. I am a full-time GP in County Louth, and I also chair the Climate and Health Alliance. And perhaps with my accrued years, I've started to understand that perhaps the most important statement or slide is the conflict of interest. So I don't have any financial conflicts or issues to declare. I am an ABBA fan. And to paraphrase them, I'm nothing special. In fact, I'm a bit of a bore because all of the climate advocacy stuff I involve in is sort of after hours. So I'm a very understanding wife. And I'm a husband, I'm a father, I'm a son, I'm a citizen, and I share the same hopes and fears are similar to anyone else. And I suppose that's the rationale for the Climate Health Alliance. I work with it. So I know that usually when I'm speaking to other healthcare professionals about climate change, biodiversity loss, there's usually introductory graphs that you have to read through. So this is an audience I can afford to skip that. And in fact, instead I'll just go straight to a brain teaser. And that is, what does Wonka, what does a donut and the Bank of England, what is the commonality there? And I'll come back to that in a few minutes. So today, I am very pleased to present a joint declaration, a consensus statement from Ireland's leading healthcare institutions. And they say the common sense is in common. Well, as Philip reminded me when we've constructed this declaration, neither is consensus, and certainly not in healthcare. We achieved it through COVID, but it isn't common that healthcare institutions all routinely sign up to any of these statements. So I'm very proud to be part of a healthcare system that is functional, provides great care, but is in perpetual crisis. And in the face of a warming planet, I'm concerned that how viable will be at all, certainly as we know it. So that just a few words in the Climate and Health Alliance there. You can see the logo up in the top corner. This is an alliance of some of Ireland's leading healthcare institutions, so academia, hospitals, NGOs. And we were born on the eve of COVID, so we've been functional for the last 5 years. And I would say that what we have to say as a boring ABBA fan, if we were saying anything controversial in terms of the evidence base, in terms of evidence-based medicine at all, really wouldn't feel confident enough to stand up here and speak to these issues. Before I speak about the joint declaration, I just want to give you an example of some of the work that the Climate Health Alliance has been doing. As it's an election year, we've produced and distributed to the main political parties an election manifesto that we hope will be incorporated by our respective institutions and members. And as I said, it's not controversial. Our big ticket asks from a health perspective are cleaner air, cleaner healthcare, cleaner diets, cleaner transport and spaces for nature. So, there will be harder trade-offs to come, but this is for us the triple wins, the low-hanging fruit. We must ask for it now, and we must be unapologetic about that. So, I just want to show an example of some of the work that's already been done to date. Philip just mentioned this. There is a lot of advocacy and work already in the healthcare space in Ireland. So on your left, you'll see just a few months ago, the Royal College of Surgeons produced their Green Theatres Toolkit, their Green Theatres paper. You see the ICGP produced a gloss or a green toolkit for how sustainable primary care might look. And then on the far side, you see the Irish Doctors of Environment produced a toolkit on how we might produce and prescribe and recycle inhalers more sustainably. These are a hotspot for emissions. And probably most important of all, as Phil mentioned, there's the climate action strategy from the HSE. And on this, there's been a flurry of activity, top-down, bottom-up, lateral, multi-stakeholder, usually involving Roisin and Breen, wherever it is. So we've been very busy, which is most welcome. So just about the joint declaration, it says two things. Yes, about the joint declaration, The first thing I say about it, I'll not read through the whole thing now, but the first thing it does, it recognises that there is a health and climate crisis, the intersectionality within, and it says that it's not a future threat, it's something we're kind of in the thick of. A few hotspots here would say, well, we want healthy lives, and we want to promote healthy well-being for all ages, but that's not radical in my opinion. That's really what healthcare is all about. Green buildings, green infrastructure isn't just good value. On the 40th anniversary of Ulrich's View from a Window study, we know that it shortens hospital stays, so it's good business, it's good health. We also know that we want equity in the climate justice, and we want to prioritise green procurement. That sounds like a benign statement, but there's actually a lifetime's work in that. All of the emissions are in the scope 3, the supply chain. And we want to challenge vested interests and misinformation. Again, there's a lifetime work in that. But we think that healthcare professionals, as Hans says, we're trusted members of the community, like a mycelium network. We're throughout the community. We have voices that are heard. So we think that we can be a part of that affectionate change. And the shift to healthier diets, more active forms of transport, stronger social interactions. And that's chronic disease management and chronic disease prevention, which is, of course, the greenest healthcare of all. So just introduce you, this isn't the red hand of Ulster now. This is an example of indigenous technologies. And I think with some humility, we might ask generations that come before us how they managed to live in harmony with their environment, comparative to modern ways of living. And it's really about values. We have our own individual needs, but do we give agency to elders, to generations yet to come, to community, cultural beliefs, spiritual and emotional well-being? And that's really the answer to the brain teaser. I mean, Hans already mentioned this. Donut Economics by Kurt Longworth says, well, we can have a booming and functional and healthy economic system, but it must respect societal boundaries and planetary boundaries. Mark Carney, the governor of the Bank of England, wrote a book just after COVID, saying, well, different book, the same message, where we place values, like checkers on a red board, can determine our overall longitudinal well-being. And just this graphic on your left here is the Wonka tree. So Wonka is an acronym for the Global Federation of Family Doctors. And the last 20 years, the definition of quality primary care has been this tree that you see. So the branches and the leaves are the various hats that we wear within the consultation. We think about the community, we think about their families, we think about our own needs, our primary care needs, and the person in front of us. So it's individual, community-based care. And last summer, two of my colleagues in our working group, one of which Andre is here, and Dr. Brussels, and with a team, they redefined quality primary care, that there's now this bedrock, the brown bit below the soil. And that bedrock is planetary health, it's sustainability, and it's One Health. So I think this issue of values is a technology, albeit ancient, and where we place values going forward will be determined. Another tool we don't think of very often is just how we talk to one another, and this was a conversation last night with the other speakers. This is potentially very powerful. This is Maureen Lipman, who, for anyone who grew up in the UK, will be very familiar with. She's an actor. She made British Telecom very famous with a really simple slogan called "It's good to talk," and that is magic dust. What happens when we talk is, an example is the joint declaration, which, as I said, is unique, that healthcare are now on the same page with climate. But another example is what's going to be presented now with my colleague Orna, a dietitian with the Irish Health Foundation. And just as a little peek behind the curtain, she's going to present the Fixing Food Together report. I remember, for all of you who write reports and papers, sometimes you get stuck. There was a phone call and Orna said to me, this is a good report, but it could be so much more. Another time we got stuck, we went for a visit to one of the co-authors' farm, and just those lateral conversations moved the paper along. Now we have something that's really rather unique, because we're all aware of diet wars and it gets a little bit political and sticky. But my healthcare said we have a consensus statement in this. So we are finding consensus in crisis. Technologies aren't methylated DNA, which is great. It's talking, it's consensus, it's meeting each other and it's our shared values. So thank you very much. And copies of the report, Fixing Food Together report, will be available afterwards, as well as the joint declaration. Thanks very much.
Hi everybody, it's a real pleasure to be here today to talk to you about Fixing Food Together. I'm going to be talking about our food system, and to do that I'm actually going to start by talking about one of my favourite movies from the 90s, The Matrix. Great movie. If you haven't seen it, don't worry, it's not that important, but the movie is about a fake reality that was created for humans. And if in the movie, the protagonist, Neo, is offered a choice between a red pill and a blue pill, and he's asked to make kind of a binary choice. And it got me thinking, what if we applied this concept to our food choices? So I have here some broccoli. Just because I'm a dietitian doesn't mean I always carry around broccoli with me. And a bag of sugar. And if I was to ask you, of these two choices, which is the most healthy and sustainable option, it's actually very difficult to know what the right answer is, because obviously in high volumes sugar is not good for our health. But on the flip side, this broccoli, what if I told you it was obviously covered in plastic packaging and air freighted from Peru? So there's consequences like that we need to consider. So my point is that it's not a binary decision what's healthy and sustainable. And we all like to think that we control our food choices, but that's in fact very far from the reality. So just like the Matrix, our food system we live in a food system in a matrix, in a way that is an incredibly complex web of all the players and actors and activities that go into the manufacture, the growing, the processing, the transporting, the marketing, selling, eating, disposal of food. So because in such a complex system, it is so incredibly hard to find simple solutions or that one quick fix, which we would all love to have. It's not possible, but we believe that by working together, as you might tell from the title of our paper, working together is the way that we can piece together this jigsaw. So I'm very encouraged by the wide representation that I see around the room today. We know that we have it's incredibly complex, and we have a lot to do in terms of transitioning to a healthier and more sustainable diet. But I guess Fixing Food Together was launched May last year. So it was really the first time that a healthy and sustainable diet was defined for an Irish context. And what makes it very valuable is that it's a unique, often missing, but very important public health perspective in a debate that's often really between other forces. So in terms of the climate change and food system. So it also highlights that transitioning to a healthy and sustainable diet is needed to not only address climate change pandemic, but also other pandemics that are interrelated, so obesity and malnutrition as well. And the aims of Fixing Food Together are to demonstrate the need for a food system transition, to identify the 6 major challenge areas that we have in Ireland, and to provide individual recommendations, but more importantly, policy level recommendations and actions, because we all know that large policy changes are what is required to exert wider system changes. So we need huge changes to be made to our food system, and we need those changes now. We spoke a lot this morning about urgency. And our food system, while it is incredible, it is also harming our health. So 1 in 5 of us will die due to poor diet alone. And a lot of that is due to diet-related chronic diseases like obesity, cardiovascular disease, and type 2 diabetes. In terms of, it's also obviously damaging or harming our planet, causing devastating climate change, biodiversity collapses. I know I don't need to go into the details to this audience here, but as well as that, it's perpetuating inequality. So if you live in a lower socioeconomic circumstance, you are more likely to have to spend more of your paycheck on food. You're more likely to develop, live with, and die from chronic disease. You're also more likely to come up against other barriers that go along with that. So transport, skills, materials, and also poverty in of itself is stressful, and that also plays a huge role in our hormones that govern our appetite and our satiety. So our food system creates more than enough food to feed all 8 billion of us, but 3 billion out of us are not able to access a healthy and sustainable diet. So is the Irish diet sustainable and healthy? So you can see from this first graphic here that the greenhouse gas emissions from an average Irish adult's diet exceeds the planetary boundary for greenhouse gas emissions by 226%. So we're way over the planetary boundary. And it's interesting that almost half of our greenhouse gas emissions come from animal source foods. And on the health side of things, we're living in a bizarre overconsumption, undernutrition paradox in that we almost half of the foods that we're currently buying in Irish households are ultra processed foods. We also have high intakes of red and processed meat, fat, sugar, salt, and calories, and not enough fruit, vegetables, whole grains, legumes, pulses, fish, seafood, and fibre. So in Fixing Food Together, we identify 6 challenge areas. So ending the junk food cycle, promoting transition to a more plant-based diet, not necessarily vegan or vegetarian, just more plant-based, harnessing the power of international and national guidelines, reducing food waste, improving agricultural practices and land use, and using a policy approach to affect behaviour change. So obviously don't have time to go into the detail on it today, but this slide just gives you a very brief example or overview of some of the food groups and practices that we in the report recommend reducing, moderating, or increasing. And we also provide various policy level recommendations from national guidelines to financial actions, agricultural actions, etc. So I want to thank you for your attention here, and our contact information is on the screen there. And my colleague Mark over here has copies of, one for everyone in the audience, copies of Fixing Food Together, as well as the joint declaration with the HSE as well, that you might be interested in having a copy of. Thank you.